Hello everyone, today we are going to talk about bariatric surgery. Do you suffer from excessive obesity that greatly affects your appearance and your health? Does obesity cause you chronic disease such as diabetes, high blood pressure, and heart disease that do not respond to treatment? Well, you might need a surgery called bariatric surgery. Weight loss surgery, also called bariatric, is sometimes used as a treatment for people who are very obese. But this major operation in most cases should only be considered after trying to lose weight through a healthy diet or exercise. During this video, we'll explain to you everything related to this operation, the reason for resorting to it, how it is performed, and the complication arising from the surgical procedure. Our role today is to answer most of the questions regarding bariatric surgery. Today we have Dr. Kim, who is a leading doctor at Hyang University Hospital. He's going to discuss with us everything about bariatric surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases.
Hello, Dr. Kim. Nice to meet you.
Oh, nice to meet you.
Yeah, before we start, please introduce yourself.
Nice to meet you. My name is Hyang Kim. I'm currently working as the head of the Advanced Obesity Surgery Center at Chun University, Seoul Hospital, as surgeon and a detailed specialist in gastrointestinal surgery. Nice to meet you.
So first question, what is exactly severe obesity and who can do bariatric surgery?
You first have to think about the definition of obesity. Obesity is defined as an excessive accumulation of body fat in our body. However, it is not easy to measure that body fat. We have to use a machine called InBody, but such measurements are not possible with a typical scale. So in order to measure how obese someone is, we use height and weight to calculate a numerical value called the Body Mass Index, BMI. Based on that BMI for Westerners, patients with a BMI of 32 or higher are categorized as Class 1 obesity, those with BMI of 35 or higher as Class 2, and those with BMI of 40 or higher as Class 3, or pathological obesity. Bariatric surgery is indicated for patients who are considered to be pathologically obese, or if a Class 2 obese patient has complications that can occur due to obesity such as diabetes, hypertension, dyslipidemia, sleep apnea, etc., then the surgery may be indicated.
So for the surgery, how much time does it take? Is it a long surgery?
Not necessarily so. The surgery can be performed relatively easily. The operation time varies depending on the type of operation, but it typically takes about 1.5 to 3 hours to complete surgery.
So how much weight is lost directly after the surgery?
This also varies slightly depending on the type of operation, but it is said that one will lose about 30% of their weight about 1 to 1.5 years after the operation.
Is there any age restrictions for people who cannot do bariatric surgery?
There's no age limit in our guidelines. It's possible to safely perform surgery on adults who are 18 to 70 years old in age, or even older. However, the older the patient is, the more carefully you have to compare the benefits against the side effects that may occur due to surgery.
So we talked about age restriction. How about weight restriction? Is there a minimum weight that you can do a bariatric surgery for?
Similar to how I mentioned the definition of obesity beforehand, weight limitation, so if the patient doesn't weigh as much, surgery is not recommended as a first line of treatment. Therefore, for patients with a BMI of 35 or less, it would be more reasonable to start medical treatment rather than surgical treatment first.
So, talking about surgery, what are there many types of it?
In fact, there are several types of bariatric surgery used around the world. It is said that there are dozens of types of them, but the most commonly used surgical methods can be divided into 3 main types. First of all, this is the shape of the stomach that we are familiar with. And when I put it on my chest, it looks like this. The most representative surgical method is sleeve gastrectomy, which cuts the stomach into elongated and then thin slices. And about 60% of the patients worldwide go through this type of surgery. The second method is Rox-and-Y. The second method is Rox-and-Y gastric bypass surgery, which involves making a small pouch in the stomach, cutting the rest of the stomach out, and then connecting the lower small intestine to it. This would be the most widely operated surgical method so far, and this was a method that was considered to be standard up until 5 years ago. The final method is sleeve plus gastrectomy, which involves attaching the duodenum to the small intestine in addition to sleeve gastrectomy. So it can be broadly divided into those three types, and there are various other surgical methods as well.
Does the surgery guarantee permanent results forever?
That could be said to be the biggest advantage of bariatric surgery. Whether it be drugs or other dietary methods, there are several ways to lose weight in a short period of time, by 10 to 20%. However, short-term weight loss is not a priority when it comes to treating obesity. It's more about whether you can maintain weight loss for long periods of time. Among one of the most representative studies on bariatric surgery is something called SOS study. And according to this study, when patients were followed up for 20 years, they were able to maintain a steady weight loss of about 25%.
Are there any risks for the surgery or any complications, for example?
In fact, no surgery is without complications. A variety of complications may occur. Since it is surgery that involves cutting the stomach and then connecting the small intestine to it, complications such as leaking from those connection points can happen while connecting the gastrointestinal tract. Actually, we can say that a certain type of operation is relatively dangerous or safe depending on how frequently complications occur. One of the most commonly done surgeries in our department is cholecystectomy. Since bariatric surgery has a level of risk comparable to that of cholecystectomy, it can be said that bariatric surgery is actually one of the safest surgical procedures.
Okay. Are there some patients who cannot undergo the surgery?
So we just talked about age. Just because you are old doesn't mean you can't undergo surgery at all. But since it is a surgery that requires general anesthesia, patients with a high risk for general anesthesia may require extra caution. In particular, patients with poor cardiac, lung, or liver function must go through careful evaluation before surgery to determine any operative risks. And it would be reasonable to opt for surgery after evaluating the degree of risk regarding the surgery.
So today we learned many things about this treatment, and the doctor explained in details everything related to bariatric surgery. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.